I'm the oncology liaison for OHC. And Kristina Liming will be our presenter today. She's a nurse practitioner and advanced practice provider here at OHC and has been here for over 15 years. Some of Kristina's special interests are lung cancer, breast cancer, and she is a lead advanced practice provider of the OHC supportive care program. And in her free time, Kristina enjoys soccer, trips to the ocean, boating, reading, and entertaining friends and family. And I just want to remind everybody that all of our presentations will be listed in our YouTube channel. So if you'd like to see review it again or share it with a friend, feel free to do that. You can find it under OHC INC, which is OHC Incorporated. And I think we're about ready to start. Ready to take it away, Kristina?
Yeah, thanks, Marianne.
Sure.
Hi, everybody. I hope you're having a great Tuesday. Today, we're going to talk about the benefits of supportive care for patients undergoing treatment for cancer. Treatment for cancer is kind of broad, so it's not necessarily patients that have to be undergoing intense chemotherapy or radiation, but really any phase of their treatment when they've been diagnosed with cancer. Today, we're going to talk about what is supportive care. What does that mean? What does that entail for patients? We're going to talk about who can receive supportive care. We will talk about why it is important for patients that have been diagnosed with cancer. And then lastly, we'll talk about advanced care planning and what is the importance with that in patients who have been diagnosed with cancer. So what is supportive care? Supportive care is kind of a broad term, but essentially it's specialized medical care that helps provide relief of symptoms and stress during a serious illness. So what all do we do during a supportive care visit? We concentrate on things such as advanced symptom management. During a supportive care visit, we have 1 hour to sit down, talk to the patient, their family, their caregiver about symptoms. Patients may come in with multiple symptoms, and we can kind of whittle that down and focus on those things that are really important, that are really impacting their quality of life. That leads to the next thing where we really do focus on improving quality of life. Quality of life looks different for all patients, families, and caregivers, and really it's up to the patient to define what quality of life is for them. And so that's part of our discussion, is defining what are those really important pieces of quality of life for that individual patient. We also guide the patient and family through complex medical decision-making, kind of exploring fears and worries, talking about their last visit. Do they understand everything that they were told? Do they understand everything moving forward? Are we getting the information across to them in a way that they understand? And then lastly, we talk about psychosocial and spiritual support and see if there's any resources outside of OHC that we can utilize to make sure that all of their needs are being met. Supportive care is definitely a patient-centered care. When we start a supportive care visit with a patient, we tell them from the very beginning, this visit is all about you. It's all about your health, all about how you're doing at home. We don't just want to talk to you about your cancer and your treatment. We want to make sure that we're encompassing all those things that are important to you. So we're providing care that's respectful, responsive to the individual patient preferences. Some patients will share a lot of information while others are kind of reserved as far as what they want to share. We talk about their needs and values and ensuring that the patient values guide all of our clinical decisions. Again, we may have a treatment plan that we want to proceed with, but we want to make sure that it's in line with the patient's values as well. Patient-centered care also allows the patients and families and the healthcare team to come to an agreement on what steps we need to make to meet those patient goals and to be involved with those patient values. So part of our visit is setting goals. And why is that important? Setting goals allows for everyone to understand the disease and what to expect realistically. I think as healthcare providers, we know what to expect, and patients probably interpret that differently. And so, again, letting them tell us what they know about their disease, what they know about their treatment, and then trying to set those realistic expectations. We can also provide individualized care that's patient and family centered. Again, there may be a treatment plan that we would like to present to the patient, but it's also important that we know how that may impact their everyday activity. Do they have to work? And if they have to get treatment multiple days a week or multiple days a month, they're not going to be able to work. And then that's going to impact their health insurance. So it's important that we're talking about those things. Informed decision making is also helpful to when we're setting goals. Patients, again, need that realistic expectation of what to expect with treatment and their diagnosis to make the best decision for them. And then introspection regarding what actually matters. What matters to a patient or their family member or their caregiver may be different, and there may be specific patient or family events that we need to focus on. For example, if a patient has a wedding they want to go to in 3 months, and can we potentially hold off treatment until they go to that wedding, or can we prolong it so that they don't lose their hair prior to that event? So it's important to talk about those things and let that guide our treatment plan as well. Setting goals can also lead to less aggressive care. Depending on what a goal is for a patient, they may or may not decide to proceed with treatment, or they may ask for a different treatment option rather than what is initially given to them. So do we need to do something less aggressive for them based on what their goals are? Can also lead to less costly care if a patient decides to just proceed with supportive care instead of intense chemotherapy. Obviously, that's going to be less costly for them. And also higher quality of care. If we're talking about the patient's goals and values, they're going to be happier with the care that they receive because we're making sure that we are in tune to what they actually want rather than just presenting that treatment plan. And then at the end of the day, higher patient and family satisfaction. If we can talk about things outside of cancer, outside of chemotherapy or radiation or surgery, and really get to know that patient and those values and those goals, we're going to have a better relationship with them, and we can have higher patient and family satisfaction. So who can receive supportive care? Anyone can receive supportive care. It's appropriate for any patient at any stage of illness, and it coincides with treatment. It's not that you're choosing treatment or choosing supportive care. Supportive care is an extra layer of support. If you have that patient that you're spending a lot of extra time with, you can refer them to supportive care, and we can talk about those things that may be not able to be talked about in a normal visit, and we can really dive into that and form that relationship with that patient. Supportive care should not be confused with hospice care. As part of the supportive care team, we do see a lot of patients where we're making those decisions regarding treatment or stopping treatment, and that's also appropriate, but it's also helpful if we can form that relationship prior to getting to that point where we're having that really difficult conversation. Lastly, advanced care planning. This is a very important part of supportive care. Advanced care planning is important for any patient with any illness or not illness. And especially with supportive care, we've got that extra time to sit down and talk to patients about advanced care planning. In the state of Ohio, we typically use 2 documents, a living will and healthcare power of attorney. We do have appointments for patients where we can simply sit down with them and help them fill out their living will and healthcare power of attorney. Simply handing those documents to a patient or family member is fine, but those can be very confusing. And especially if they're at the beginning of their treatment where they've got this new diagnosis, this new treatment plan, they're trying to make sure they're taking all their medications correctly. Handing them one more piece of paper that they have to figure out can be difficult. So by having them come in, having that extra visit with them to go over the living will and healthcare power of attorney can be helpful. When do we discuss advanced care planning? Really, you want to do it while the patient's in good health. You never want it to be a crisis situation where then you're asking them, well, who do you want to be your healthcare power of attorney? Preparation is always better than crisis. If you have a patient who has a very large family and they're choosing one of their 6 children to be their healthcare power of attorney, it's helpful if they have written that information down, they've talked to that particular child, as well as all of the other children. It's always helpful to make sure that the whole family knows what their wishes are in regards to their living will and healthcare power of attorney. The other important thing is that their advanced care planning documents should always be reevaluated with any change in health status. For example, did their cancer progress and now we need to talk about their advanced care planning? Has their status deteriorated and now their health status is much different now than it was 6 months ago when those documents were completed? So going back over those is also very important. So in summary, supportive care can be utilized by any person during any phase of illness to assist with symptom management, setting goals, improving quality of life, complex decision-making, and advanced care planning. Hopefully that answered some of your questions about supportive care. Does anyone have any additional questions?